some mildly abnormal behavior and potentially a weird sound.
Yes.
Yes, but no other abnormalities other than he's a little bit just decreased energy from his brother.
Yeah.
Are they litter mates, like
Yeah.
direct siblings?
Yeah.
That sounds like an adventure.
Oh, yeah, I've got 4.
That's a choice.
Yeah. They're just so cute.
Yeah, he's very cute. Thank you. So yes, I mean, can't tell you what that sound was. It'd be lovely to like see a video of it if it obviously continues.
I know, it's just super weird. I wasn't sure like if it was maybe his teeth coming in.
Right.
He lost a lot of teeth at once, it seemed like.
Uh-huh.
And so I don't know if he was just irritated and it was almost like
Right. Yeah.
like when he was eating.
Okay.
But he did it after I played with him one night.
Okay.
So I was like, I don't know, does he have like an upper respiratory thing?
Right.
Or...
And does he notice any nasal or ocular?
Yeah, his eyes
A little bit.
have been a bit goofy.
But any sneezing or coughing at all? Like not a significant amount.
No, I know one of my cats just sneezed either this morning or last night. But
Okay. Nothing like ongoing.
No.
And it wasn't like he was in the litter box when he made that noise.
No. It's usually when he was eating his
Okay.
dry food, and
Okay.
then that one time with the playing, and I was like,
Okay.
oh, in the bedtime, we were just about to go to bed, and he made that noise the very first time I heard it, and I was like,
Okay.
um.
Look at those teeth. Oh, I know. I know.
Sorry, he's a bad patient.
He's not at all. Trust me, cats can there's a wide range of cat temperaments, and his is on the very easy to deal with side, I would say. Good man. Those look lovely. Yes, his adult teeth are present. Hey?
So I'm wondering if maybe it was just the teeth and he was irritated. I'm not
I mean,
sure.
or he choked on a piece of food. I don't know. Yeah, I don't have a good explanation without, like, even if I saw a video, I'm not sure I would have a good explanation either, but it's difficult to fit the pieces together.
We think he might be a little bit special.
Yes.
Normal there. Like he actually, like if you go to play with him or do anything with food, he'll actually like tilt his head like a dog.
Right.
And we're just like,
It's just a little
so
different.
weird.
Is he your first orange cat?
Yeah.
Okay, because we were joking in the back that orange cats are like kind of a special species.
Yeah.
They're sometimes known to be a little different. Hey? Yes, his heart sounds lovely. His lungs, I would say like maybe a mild increased like in sound, no like crackles or wheezes, but just like a bit more like harsh sounds, but typically.
I've noticed that his breathing is a bit more pronounced.
Okay, I was gonna ask. Okay, and like when he stops like activity earlier, do you find that's because he's like panting or like breathing really hard, or usually just like loses interest?
I haven't noticed like the panting or anything like that.
Because yeah, breathing can be difficult for us to assess in clinic sometimes, to be honest. Like just an increase in lung sounds can a lot of times just be stress or like excitement in clinic because they're taking big deep breaths because their adrenaline's going and things like that.
No, I definitely noticed that.
noticed, okay.
Yeah. Even when he's just resting too, it
Right.
seems very...
Okay. And I'm not hearing any like upper respiratory referred noise. So I suspect it's lower. And then he does have a little bit of the discharge and stuff. So I mean, it's typically speculation, but a lot of the cats that come like through rescues and stuff like that will get a virus as a kitten, and then they become like chronic snufflers, is what we call them. So they get like colds every so often. Typically, it's just like occasional discharge from the nose or eyes, and then in times of like stress or immunocompromise, they can like kind of become more of a severe cold with like severe ocular changes and things like that. But he's certainly not showing any of those signs right now. But it may be something that is ongoing for him.
Yeah, maybe it was the cold and that's what the duck sound was.
Right. And how long have you had him now?
The end of May.
Okay, a little bit of time. So not, and no like changes in environment or anything like significant in the last little bit.
Well, my boyfriend and I, we are thinking about moving in together, so he's been introducing us dogs, so that could be a bit of stress as well. Like, we've just been bringing her over for a movie here and there a couple times a week, just slowly introducing.
Yeah.
And he does not like her.
Okay. Yeah. So I mean, stressful. Some of those stressful things can kind of suppress them, the response a little bit. I'm not overly worried about it right now. I would. Oh. Interesting.
That's it. That's it.
You
are lucky. You're so lucky. That was it.
Huh.
Oh my god.
That's so funny.
I'm so glad you got to see that.
Yeah. It's that's interesting. That's so funny.
I'm so glad.
Mm-hmm.
It's not that we didn't believe you.
Yeah, exactly. It's good to see it in motion. It's almost so. I can't tell if it's something like mouth discomfort where he is like anticipating eating, so he is like doing that because he's like, oh, this hurt my teeth, because his teeth have newly erupted. He has some gingival inflammation, that sort of thing. It also almost looks a little bit like a gagging, like if he was nauseous that he would like kind of be gagging because he smelled the food, but he's eating the food now, so I don't suspect he's actually nauseous. That's odd. Is he like a toy eater? Does he like ingest anything?
No.
Okay. Well, the only like, I mean, it's something in the throat, I would say, or in the back of the mouth, or to do with the oral cavity in general. I'm gonna take him back and see if I can look in his mouth. Unfortunately, in awake patients, we don't have a lot of success.
It's okay.
But I'll try to see if I can look under his tongue, because cats are notorious for getting like foreign bodies and things like that. So we'll see if we can see in there, and then our options will be like either kind of monitor and see if any other symptoms pop up, or like we could do a sedated procedure to like look in the oral cavity. It's without kind of other symptoms going on, I hesitate to do like a full sedated procedure for something that may or may not be significant. So I'll take them back and see what we can see.
Oh my god, I'm so glad.
That's impressive. Like, yeah.
Oh my god.
Worked perfectly. Good thing I brought those treats out, eh? Okay, we'll be right back. Oh, kind of a coughing, but also a little bit of a gagging. It was odd, like a honk. It wasn't a lot of like noise to it. It almost was more like a gagging.
Can you sit? Let's just sit. No, we're sitting together.
Sorry, I don't know around that.
You sit nicely together, like this. There.
The owner was so excited. I was like, are you honestly because
Love that for you.
but now I'm worried he has something in his throat. He's got like a baby tooth stuck back there and stuff.
Maybe.
In his tonsil.
Maybe your mom didn't get all of your teeth off the floor.
This light's not gonna be that helpful. Okay, mister. Hello. Oh. I can tell that's a string of saliva or a string. Doo-doo gotta be.
Oh, this is not very helpful, sir. No. Shall we just try maybe grab your body?
Like us after this.
I'm sorry. Oh, come on. What's all of that about?
I'm worried he has something in his mouth. I saw like a glimpse of a little string-like thing, but it could have been saliva.
Mm-hmm.
But also given his reluctance.
Why you gotta be
like
such
that.
a goob? I know. Yeah. Can you yell so she can see?
I know. I know. I guess we're saliva.
Well, okay. It's unnecessary.
I know. Keep doing that and then I can hear.
More yelling and less lips.
Jeez. Scary. I'm sorry, buddy. I'm sorry. That's so sad. I'm sorry, buddy. You're so pathetic. I try to look under your tongue. I know it's really annoying, but you gotta do it. treats anything. Nothing here, Lori. Open it one more time. Good boy. See if I can hit that somewhere. I don't know, bud. Say ah. Say ah. That's a good ah. Hold it. You don't need to crunch. Okay. I don't see it. I didn't. It doesn't react when I puppy this face, so. Yeah. Nobody. Anything in there, and then like a decent view of the back of the mouth and not seeing anything abnormal. And he's really not reacting to me like palpating under here or his throat area right now. So
Okay.
yes, so that's kind of where we're at. I mean, at least we know what's the. I have documentation in my brain, I guess, of what that is looking like for him, and then just see if it continues. It's possible it's kind of related to the oral pain of his teeth eruption, and he was just feeling discomfort, and he associated with that with eating, and then playing, I guess, also if he was using like chewing on the toy with his mouth, and he was thinking the same. So that's certainly not something I've seen before. And then in terms of his his respiration, his breathing, again, it's not to the degree that I'm like really concerned about it right now, but something like x-rays could be beneficial in the future to see what that's looking like.
Do you think he might have a bit of asthma?
That's the other thing. Asthma, I guess it can happen this young. I usually see it in a bit older cats, but asthma is not an uncommon thing for us to see. So that would be something that we can see evidence of on x-rays, but usually it's kind of diagnosed based on symptoms. If you see any coughing, that sort of thing, then try to take a video or let us know.
My other boy, he does have asthma.
Okay.
I did give him an
Okay.
inhaler, so at least it wouldn't be foreign.
Yes, exactly. Yeah. So you're probably already doing all the things of like reducing environmental contaminants and all that stuff
Yeah.
at the basis of kind of reducing that stuff. So
Should I do an X-ray or?
like I said, it's I mean, for peace of mind's sake, I guess it's beneficial, but also I would be surprised if we saw anything abnormal on it. So it's up to you at the end of the day.
Let's just do it. We're already here.
Okay, yeah, we can do it.
And at least we'll have like a baseline too.
Sure. Yeah. Well, he's fairly tolerant, but sometimes we do x-rays under sedation, so we'll try without sedation. And if he does need a sedation for it, I can send you an estimate for it, and we can do it another day, just because timing probably won't work out today for him to do a full sedation. And then we can also look in his mouth. Okay, we'll go take some x-rays of your chest, and we'll be right back. Okay, mister? Can you tolerate it? We'll be back shortly.
Sounds good. Thank you.
In his x-rays, they're mild changes, and it can be due to, again, him not taking like a full breath, so his lungs aren't fully open and everything. But they're a little bit busier in here than I would expect, I would say. These lines and things like that, typically, I think I have a normal image here. So this is like what a normal cat lung looks like. So this is fully inflated, very little, like there's some small like airways you can see here, but his are a bit like busier, is what I would say. And I'm not a radiologist, so I don't do this for a lot, like for my everyday. We diagnose things that are straightforward and easy. But in this case, I would say there's some mild changes there that are consistent with something like a bronchitis, or it can be like inflammation of the airways, like associated with asthma. So in a cat of his age, asthma is like, to be honest, lower on my list. Higher on my list would be something like a viral or a bacterial type bronchitis at this point. So for him, I would recommend starting on some antibiotics for 2 weeks, just to see if that improves things.
Sure.
It's not going to do much harm, like most antibiotics are fairly benign in nature. They can cause some vomiting and diarrhea. If that happens, we can discuss it and change the plan. But I would start with that, see if we see any improvement in his breathing at home. I don't know if that noise he made is associated with this. I don't think it is, because that was very like upper mouth. I think that was more related to his oral cavity. But in terms of his like breathing and his energy level and things like that, see if that improves with some treatment. And then if there's no treatment, or no improvement, we repeat x-rays, I would say again,
Sounds good.
under sedation to try to get like a perfect image and see if we are seeing any more or less information.
Sounds good.
That sounds all right? Yes. Okay, we get you the medication then,
Awesome.
and then, yeah, if everything goes all right, then just let us know. We'll check in about a week and see how it's doing.
Oh, sounds good.
Okay,
Awesome.
take care.
If you
Yeah, no problem.
just go up with the front.